This is John Gibson. I'm reporting here at Parathon's Revenue Cycle Summit. With me we have Cameron. Cameron is the Director of Payer Contracts, correct?
Correct.
With Honor Health. He's an existing client with us. And we were sharing some dialogue a little bit about his role within the organization and really his experience with leveraging our tool Parathon within that role. And really to that note, we were discussing a little bit about his payer negotiations and sort of what that process looks like. And I was asking Cameron to share with us a little bit, share his insights around how he leverages Parathon to help better facilitate contract negotiations with these payers. So with that regard, can you share any insight to how you use the parameters of the tool and what you find within it?
Yeah, one of the biggest uses for the tool for us is doing what-if scenarios and doing benchmarking imperative. So when we're looking at different contractual scenarios during a negotiation, what we will do is we will bring in claim sets from multiple different payers using their different fee schedules and then benchmarking them against CMS, which is a built-in feature in Parathon as well. So then when we look at all the different contracts with all their different provisions, it allows us to create some type of standardized way to view them. And that's one of our biggest uses for the tool today. Along with that, it allows us to report out certain information, review certain information at a very line level, and then we can take that into our negotiations and show them the impact of how their fee schedules or their reimbursement models impact us.
Right. So with that, once you present these results and these tested scenarios, right, these modeling scenarios that you're trying to negotiate through with your payers, do you find that you're helping facilitate a less adversarial relationship with them? Is it more kind of symbiotic? Are you working together?
Yes, absolutely. I mean, when you can go to the payer and show them in certain areas or certain service lines that it's there's real proven data to show that either you're making money, not making money, or it works or it doesn't work in different sites of service, and you bring it to them in a format that they understand with actual evidence, empirical evidence, it brings a different discussion or dialogue, maybe even at a higher level of your relationship than it would be of just a transactional discussion with anecdotal information.
Sure. And I'm asking this one off the cuff, but I just thought of it through your answer there. Without maybe naming any payers, would you say that you found any particular proposals, and then after modeling them through Parathon, maybe they were a little bit less than what they were initially presented to be? Or
absolutely, that's always part of it. Everyone models a little bit differently, but the impact of the services or their mix of their clients, whether self-insured or fully insured, down to being individuals on the exchange, all of that can impact their fee schedule and has different repercussions for really how you get paid. And using the modeling software allows us to kind of input those different variables and get a true net effect.
Wow. Cameron, this is enlightening stuff that really appreciate you sharing with us.
Nice to meet you, John. Thank you.
Cameron.